Hello, I am Dr. Tina Meder, and welcome back to the Skin We Live In podcast. Today I want to discuss the skin diagnostic. Probably you think that it can be actual only for someone working as a professional in the skincare industry. So for beauticians, aesthetic nurses, some other skin practitioners, even aesthetic doctors. And yes, it's one of the most important tools for all practitioners of the beauty industry, because without the right diagnostic, you cannot prescribe a home care, you cannot give a proper recommendation, and you cannot choose the right treatment for the person. But I think that even if you are not a professional, if you just love skincare or curious about skincare, how it works, or you are looking for some facials or some aesthetic treatments and you are not sure which one you should pick and how to discuss about it with skin professionals, this episode can be for you. So let's start. What we do in the treatment room when someone is coming for the first time for consultation. Obviously, first of all, we say hello, nice to meet you, offer some coffee, but after we start the real conversation. And it is not only about what you want to change in your skin, what you are unhappy about, what you're happy about. And unfortunately, many of these conversations, they're very much focused on some wrinkles or pigment spots, which clients or patients brings to practitioner. But the story is always deeper. The real personal story is complicated. So it is not enough to know that you have some dark spot on your cheek or you have wrinkles between eyebrows. We should understand much more about your skin. We should understand how your skin lives, what type of sebum production your skin has, how efficient is your skin barrier, and what type of pigmentations or wrinkles you have. Because, believe me or not, but we have many types of wrinkles and we have different types of pigmentations. By the way, if you are curious to know more about it, you can find episodes about pigmentations and wrinkles in the Skin We Live In podcast. I've been speaking about wrinkles for 1 hour. But the consultation and the skin diagnostic, it is precise algorithm. And me as an experienced educator, I educated beauticians and skin practitioners in more than 30 countries of the world for more than 30 years. So I've been teaching thousands and thousands of practitioners during my life. And also I've been practicing myself for almost 20 years, running my own clinic. So I created this algorithm of the diagnostic, which I'm absolutely happy to share with everyone who is interested in it and happy to share with you now. So what is the diagnostic? What we have as a traditional tools? Most of the time when you Google or ask Chat GPT or another AI tools about the skin diagnostic, you will have the simple question. Skin can have few types. 3 types for some minimalistic point of view. So skin can be dry, skin can be oily, skin can be normal, somewhere in between. Another story that can be 4 skin types if it includes sensitive skin, and sometimes you can see even 5 skin types. For some reason, redness can be seen as a specific skin type additionally to the sensitive skin. Every time when I see these classifications, I want to say that it was created more than 100 years ago. Yes, it was actual. Thanks Elizabeth Arden, who created this first classification of skin types. It was amazing and it was very helpful to sell creams and lotions at this period of time. But if you think how our world changed in the last 100 of years, literally everything changed except for skin classification. Even astrology is more complicated. In astrology, at least we have 12 signs of zodiac. And with traditional skin classification, we are trying to split 8 or more billion people in the 4 uncertain groups. So the classification is more interesting complicated and much more scientific. Myself, I am using the classification created by Professor Leslie Baumann, who is a dermatologist working in Miami University. And Dr. Baumann created this classification and published it in the first time in 2005. I was lucky enough to buy her book, Cosmetic Dermatology and Skin Type Solution, in 2005 when it was published, the very first edition, in Paris, during the International Master Class of Anti-Aging. And since that, I was so impressed. And I'm using this classification, and I always recommend to use this tool to all beauticians and skin practitioners, aesthetic nurses, aesthetic doctors who are interested in the objective results and objective follow-up of dynamics of all types of treatments and therapy which they offer. So how it works? Dr. Baumann offers a classification splitting everyone in 16 skin types, and these skin types are defined by 4 groups of questions. First question is about the sebum production, so you should know how dry or how oily the skin is. Second question is about skin sensitivity, sensitive or resistant the skin is. Third question, it's about the pigmentation. Skin can be pigmented or non-pigmented. And the last question, it's about wrinkles. So wrinkled or not. Everything is coded by the first letter of the answer. So we have D for dry, O for oily for the first group of questions. We have S for sensitive and R for resistant skin. We have P for pigmented and N for non-pigmented versions. And we have W for wrinkles and T for tight, non-wrinkled skin. And all these 4 letters, when you answer to these 4 questions, you put these 4 letters in the type and you have 16 variations of skin types. It looks simple, but actually it's very clever. Because just looking at these 4 letters, you can literally see the person behind it. For example, you see letters like D, S, P, and W. It is someone with a dry, sensitive, pigmented and wrinkled skin. So I suppose it would be someone mature, maybe in the 40 plus or even 50 plus categories of clients. It is someone who's been exposed to the ultraviolet. Maybe is some nice sun lover who didn't use sunscreens enough during the last years. And is someone who is experiencing some discomfort with their skin because skin is sensitive. So you have this full portrait of the skin. As opposite, you can see someone with letters O for oily, R for resistant, N for non-pigmented, and T for tight. So oily skin, no pigmentation, no wrinkles, no sensitivity. Apparently, that's someone young or extremely lucky. When you see letters which I call good letters, R, N, and T, you know that you have few problems. If you see what I call bad letters, S, P, and W, you know that you have a work to do. So it clearly defines the problem, it clearly defines the combinations of the problem, and also it helps to evaluate the efficiency of the treatment and the efficiency of the skincare this person uses. So if it is someone with all these bad letters and the first letter, for example, D, and we recommend to use some skincare routine built for dry, sensitive skin with some product helping to diminish visibly wrinkles and some brightening skin product. We suppose that it should work. So if in 3 months' time we see changes, at least in one letter, for example, the skin is not sensitive anymore, it became resilient, resistant, it would be great results and we will continue to work on it. But if we see the none of these letters changed, very probably we are not on the right trajectory, so we should change the strategy. But It is not enough to know only if the skin is dry or oily, if the skin is pigmented or not. To understand it deeper and to be able to prescribe the right type of treatment and right type of the skincare, we should evaluate the severity of these changes and decide if this condition should be addressed or probably not. Let's start from the first group of questions. Dry and oily. It sounds easy because who cannot recognize dry skin or who cannot recognize oily skin? Oily skin is shiny, pores can be enlarged, oily skin is easily inflamed, dry skin is opposite, pores are almost invisible, it can be tightened, it can be discomfortable, it can be easily irritated, and it can be thickening. But to understand how dry the skin and how oily the skin, we should use some grades of severity. In the dryness and oiliness assessment, I always suggest that we split everything in 4 levels. First level, the mild dryness and mild oiliness, it is completely normal because it's not such thing as a normal skin. Everyone has a tendency of sebum glands to be slightly overactive or to be slightly underactive. That's not such thing as the perfect sebum glands working perfectly all your life. And we are born with these types of activity. It's genetically predisposed. If you've been born with your skin being oily, you will keep this oily type of the skin during all your lifetime. It can be compensated. If it's not addressed properly, it can be worsened. Same for the dry skin. But when we classify it as mild, what does it mean? Then most of the time you feel comfortable, your skin is healthy, it is not inflamed, it's not bring you any discomfort. But under the stress, you feel some discomfort in the ways and your genetic predisposed you. For example, you are traveling, you take long distance flight. People with a predisposition for the skin dryness, they will feel like their skin is dried off during the flight. People with a predisposition to the oiliness, they feel that it's uncomfortably shiny and oily and maybe slightly inflamed if they suffer from period acne or stress-related acne or something like this. But most of the time, it's perfectly normal. And actually, it's no need to address it. It's no need to treat it. Enjoy. Your skin is healthy. Moderate level of dryness or oiliness. It can be uncomfortable under some conditions. So when your skin is moderately dry, you very probably love moisturizers. People even with moderately dry skin, they are using moisturizer without any reminders. They love to use them because naturally, following the circadian rhythm of the skin, our skin is less hydrated during the nighttime. So if you have a tendency to the dryness and if it is moderate, you will wake up with a dry skin and you want to apply the moisturizer. Same for the evening time. Because during the after lunch and evening time, your water evaporation will naturally increase. For the oily skin, the timing will be slightly different because normally, once again, following circadian regulation, our skin produces more sebum starting from the late morning, like about 11:30 a.m., and coming to the peak at the lunchtime. And after 3:30 p.m., our sebum glands are starting to deactivate. If your skin is slightly shiny during the midday, it's absolutely normal. But if your skin starts to be shiny earlier or stops to be shiny later, if this glow and this excessive oiliness is discomfortable during the day, that means that your skin is moderately oily, so both conditions can be addressed with a proper skincare. Good moisturizers for dry skin and some sebum controlling, slightly mattifying products, some weekly care for an oily skin. It is still healthy, it's no need of specific treatment. Skincare works perfectly in this situation. If your severity of dryness and oiliness is more noticeable, we call it marked stage 3, then it would be uncomfortable and it would be very difficult to find the proper skincare which can control both of this condition. People with marked dryness, they are constantly looking for the new moisturizers. They have a tendency to layer moisturizers and different kind of product. And most of the time they're still unhappy. So they spend fortune on moisturizer. If you recognize yourself now, so you have grade 3 skin dryness. For people suffering from the grade 3 oiliness, they very probably suffer from acne. And if they perform under the stress, if they are exposed to the air pollution or to the ultraviolet, very probably the skin condition is worsening and they feel like their skin is too oily and too shiny during the whole day, not only during the midday. And finally, severe dryness and severe oiliness, very often there are signs of dermatosis. So if the situation is uncontrollable, if your skin is so dry, then it's flaking all the time, it's inflamed, you have some fissures, and some severe cases it can be painful, very itching, and even bleeding may occur. You should see a dermatologist and you should be treated properly because very probably it's a serious skin condition behind it. If you suffer from acne, if your skin is constantly uncontrollably oily, if you see some symptoms of seborrheic dermatitis like very pronounced shine and possible redness, inflammation, greasy scales, especially in the hairline, once again, you should see dermatologist. Why it's so significant for skin professionals and for everyone who is interested in finding the right skincare, you should understand then with the mild and moderate level of dryness and oiliness, it's perfectly normal. It can be addressed with the skincare. At the level 3, there are specific treatments which can help the skin. Very probably you need some intense, more serious approach to your skin, and professional treatments like biofascials can help a lot in this situation. And finally, if it is really severe, dermatologist is your answer. Additionally to that, in case of oily skin, we always add the acne evaluation for patients and for clients with marked or severe skin oiliness. To evaluate acne, we are using so-called Investigators Global Assessment of Acne, IGA, Acne Severity Scale, when we have 5 different groups of people. Group 0, the skin is clear, so there are people in the remission or with successfully treated acne. Group grade 1, there are people with very mild form of acne, so few comedones, not prominent inflammation. Group 2, it's a mild moderate form of acne when you have dozen until 15 comedones and 1 or 2 inflamed elements like papules or pustules. In the moderate grade of acne, grade 3, you notice more than 15 comedones, and the process is not unilateral, so you see it on the right side of the face and left side of the face. Also, you can experience the acne on the body, on the shoulders, back, maybe the breast area, and you can experience by some painful nodules as well. And finally, severe, very severe acne, the grade 4, multiple lesions, multiple elements, prominent inflammations. In 90% of cases, the acne spread on the body as well. So this grade should be addressed properly, and that's only grade when official acne guidelines suggest systemic therapy, including systemic retinoids. The rest is treated topically with the use of topical treatments. In the grade 3, they can be used some energy-assisted treatment like laser, but in the grade 1 or 2, skincare routine should work if it's chosen properly and individually. But suffering from acne, you should remember that you cannot treat acne in one night. That's a chronic skin condition based on the multiple factors behind acne. If you're interested to know more about an acne, please listen to the acne episode. And you should give at least 8 weeks before you evaluate an efficiency of the treatment. It is impossible to say how efficient the treatment is in 3 or 4 days. You should give it a time. And in the same time, you should address the skin oiliness in the first place as well. So, okay, we answered the first question. D or O, dry or oily, and how severe this dryness or oiliness is. The question 2 is Shakespearean. How sensitive is your skin, if even sensitive? So sensitive or resistant, that is the question. Fortunately, we have some objective tools to evaluate the skin sensitivity, and it's kind of tricky because it's not objective diagnostic. Even histology, even biopsy of the skin doesn't give you a proper answer. Is it sensitive or not? Because the skin sensitivity is very much related to the status of the nervous system, because nervous system is closely related to the skin. Embryologically, they are twins. Until the 5th weeks of the embryo development, nervous system and skin were the same organ called ectoderm. So they continue to communicate and to interact every second, every moment of your life. And it is difficult to diagnose with instruments, but it is possible to diagnose with objective questionnaires. And the best one was developed by the Professor Laurent Misery. It is well known for the last 20 years. It's called SS10 Sensitive Skin Scale. And all you need to evaluate your skin sensitivity is rate each symptoms from 0 to 10. And you should remember that each symptoms should occur over the last 3 days. So it can be irritability, stinging, burning, heat sensation, tightness, itching, pain, skin discomfort, flushing, and redness. And you simply evaluate it from 1 to 10, when 0, that's nothing, you didn't experience this symptom at all, and 10, that this symptom was so intense, you couldn't forget about it for a minute during the last 3 days. Actually, in the average, people experience, even with sensitive skin, they experience 5 or 6 symptoms from 10. And fortunately, most of the time, it's moderate. So it doesn't disturb your sleep and it doesn't really affect your life quality badly. If it happens that your skin is very sensitive. When you rate each symptoms, you simply add 10 rating and you get a total score. From 0, which never happens, to 100, which I never seen in my life, fortunately. How we evaluate the sensitivity of the skin based on this score? If the score is lower than 20, your skin is resistant, congratulations, you can do whatever you want. And obviously you can irritate your skin with aggressive skincare or some treatments and change the category. But for now, you are good. You are in the good place. If the score is from 20 to 40, your skin is mildly sensitive. So your choice of skincare should be careful and strategic. I always recommend to switch for sensitive skin cleanser and sensitive skin moisturizers and basic skincare in this situation. If your score is in between 40 and 60, your skin is very sensitive and you are very discomfortable, very probably. So your skincare should be exclusively designed for sensitive skin, and you are very limited in the choice of any types of aesthetic treatments. Literally nothing we can do from intense treatment in this situation. So your skin should be calmed down, and less is more. So we try to quiet this inflammation and irritation. And finally, if your score is over 60, you should see a dermatologist and maybe even general practitioners, because there are a lot of hidden conditions behind this skin sensitivity, especially if it appears from the blue sky and if you started to experience it suddenly. So you should be careful and you evaluate your sensitivity skin score. And after using some skincare routine for a couple of months, you can reevaluate it again, and it is a good sign if your sensitivity score is decreased. If your sensitivity score is increased, so you are not in the right way, you are not in the right trajectory, and you should be very careful about the strategy. It can happen if, for example, you've been prescribed retinol or retinol derivative. But you should understand then this irritation has some price. So me as a practitioner, I always trying to calm down the irritation because the inflammation is one of the most powerful hallmarks of aging. And if your skin is irritated, red, and uncomfortable, be sure your microbiome is not balanced as well. Happy microbiome means happy skin. And microbiome disbalance, it's also hallmarks of aging, so the chronic skin irritation accelerates skin aging. If your skin is red, in the professional setting, we are using specific redness score, which is numeric guide, to evaluate how red is your skin. To evaluate your skin redness, you should know 3 parameters. You should evaluate the redness intensity subjectively. Just evaluate by yourself when 4 is very red, 0 is not red at all, and in between the variation of the redness. Second parameter, it is an area affected. 0 area means that you have no redness at all on your face. Score 1 means that your mid-face is red or just the part of the face is red, for example, forehead. And gray score 2 means that the full face is red. And the last parameter is the telangiectasia or cuperosis, spider veins. If you don't have at all spider veins, the score is 0. If you have up to 3-5 spider veins on your face, the score is 1. If you have more than 5 spider veins, the score is 2. And you simply add these 3 scores to each other. For example, you have moderate redness 2, only mid-face is affected, +1, and you have 3 elements of spider veins of cuperosis on your face, +1. So the number is 4. If the redness score is 4+, your skin needs a special attention and probably special skincare. There are a lot of anti-redness skincare now, and in Medder we offer Redapax skincare routine for everyone experiencing skin redness. If your score is higher than 6, your skin needs medical attention because it means that you are in higher risk of development of rosacea, or you are diagnosed or should be diagnosed with rosacea. If you don't experience any redness, great. You need only sensitivity score. Question 3. Dr. Baumann asked about pigmentation first. I prefer to ask about wrinkles first because pigmentation takes the most difficult math work. Wrinkles are quite easy. First of all, we should understand the type of wrinkles. So once again, listen to the episode about wrinkles. It is interesting. We have different types of wrinkles, expression wrinkles, which are developed because of the active mimic expressions. They are located mostly in the upper face area. They can be some static wrinkles, age-related wrinkles, for example, nasolabial folds, wrinkle development because of the gravity changes. They can be so-called crinkles. They are superficial chaotic wrinkles related to the skin dryness and dehydration. And finally, they can be fold and lines created by age-related changes in the body. They are characteristic of the mature and aged skin. Each of these types of wrinkles needs a specific treatment. There's no point to treat nasolabial folds with Botox injections or with peptide-based product designed to diminish and eliminate expression wrinkles. And same for expression wrinkles, it's no point to use hyaluronic acid-based fillers for their treatment or to use moisturizer in the hope to eliminate them. So for each types of wrinkles, you should choose the appropriate types of treatment, which can be topical, skincare, or can be injectable or energy assisted. And to understand what type of treatment and what intensity of treatment you need, you should understand the score of your wrinkles and severity of your wrinkles. Once again, it's quite simple. We have 4 grades of severity, from 0, no wrinkles at all, to 4th, when wrinkles are very severe. In the group first, mild wrinkles, when your face is resting you cannot see wrinkles at all, but when you are speaking, when you are emotional, you can see some lines. Moderate score 2 wrinkles can be seen at rest, but they are very superficial and not so visible, easy to camouflage with different types of makeup. If your wrinkles look more or less similar at rest and in the active expression, we are thinking about severe grade 3 type of wrinkles. And finally, if you have very deep and prominent wrinkles which doesn't change at all when you sleep and when you're relaxed, you have very severe wrinkles. Why it is important to understand? Because if you have mild wrinkles or moderate wrinkles, no need to use some injectables, honestly. No need to go for laser resurfacing or dermabrasion or whatever it can be. Proper, efficient, modern skincare will help you enough. For example, for expression wrinkles in Medar, we have MyoFix peptide-based active cream, 5 peptides. You're using it for 5-6 weeks, and your wrinkles will be well controlled and very visibly diminished or even eliminated. If you have some wrinkles, mild or moderate, appropriate hydration, moisturizer, in Medar it would be a hydrofill treatment, you will be great. You will see no signs of them in 5 or 6 weeks. But if your wrinkles are severe or very severe, that's a place for injectables, that's a place for energy-assisted treatments. But I always suggest give your skin first couple of months with a skincare, because you will create the healthy foundation, restore the proper hydration for your skin, restore the barrier function, calm down the inflammation. You will be surprised how better your skin will look and how your wrinkles change. Because your wrinkles can be transformed. They can be twice diminished using the skincare, aiming the healthification of your skin. If you want to score your wrinkles properly and objectively, you can use the Merz scale. It is the official dermatologist and aesthetic scale used by aesthetic doctors, dermatologists, and plastic surgeons all over the world. You can easily find it online. If you are practitioners, very probably you have your tools, you have your atlas of the Merz scale. And finally, coming to the pigmentation. We should understand what type of pigmentation you have if you are unhappy and find some pigment disorders in your skin. Speaking about the hyperpigmentation, the most common, it is melasma, also called chloasma, and the specific type of melasma, it is a pregnancy mask. But also it can be age-related, senile lentigo, it can be different types of pigmentation. Dermatologists, aesthetic doctors, they are best specialists to diagnose the specific type of the pigmentation. And we can score the severity of the pigmentation using the special melasma area and severity index. It is a scale which is abbreviature is MASI. It is a clinical tool to score how severe facial hyperpigmentation is, largely used by plastic surgeons, by dermatologists, and I believe it should be used by everyone because photo is not enough to evaluate the pigmentation. Paradoxically, photo, even standardized photo, can be less clear than this numeric index. Yes, it takes a little bit of time and a little bit of work, but everyone is equipped with a calculator now. If you have a phone, you have a calculator. So what you should know to calculate your MASI score. First of all, the area. We split the face in 4 zones: forehead, right cheeks and left cheeks, and the chin. Chin takes about 10% and all the rest takes by 30% of your face. We should evaluate each zone separately. So you go through each of 4 zones with 3 questions. First question is how big is the involvement of this zone? It's called A area. Score 0 when it is no involvement. For example, you don't have any pigmentation on your right cheek. 0. If it's less than 10% of involvement, score is 1. 10, 30% score is 2, 30, 50% 3, 50, 70% 4, 70-90%, 5, and if everything is covered by the pigmentation, the score is 6. Second parameter is darkness. It's a bit subjective, so it is important that the same person should evaluate the patient following the treatment to evaluate the efficiency of the treatment. And darkness we grade in using 4 scores. 0, nothing, normal skin color. 1, barely visible pigmentation. 2, mild pigmentation. 3, moderate pigmentation. And 4, severe, very dark pigmentation. And the last parameter is homogeneity, H. If there's no evidence of hyperpigmentation, it is 0. If you have just some specks of involvement, the grade is 1. If there are small patchy area in the zone, the score is 2. If the patches are more than 2 centimeters in diameter, score is 3. And finally, if it's uniform skin involvement, score is 4. Remember, you should go all 4 zones with each of these 3 parameters. So you just, you evaluate and you put the number in the list on your phone, in your client card. And after, you take a formulation. So you should calculate the score for each zone separately. For each zone, you add darkness to homogeneity, and you multiply the results on the A in area involvement. And this result you multiply with a coefficient related to the zone. It would be 0.3 for the forehead and both cheeks, and 0.1 for the chin. And now you have 4 numbers, and you simply add these 4 numbers all together, and you have the final number, the MASI score. If you want, you can keep these 4 numbers separated for following dynamic. But first score, when you add everything, it is important because that's how we evaluate the severity of the pigmentation. Actually, it's used in all, as I know, efficiency clinical research of the pigmentation in clinics over the world. It is from 0 to 48. 0, it's nothing, no pigmentations at all. If your level of the severity of pigmentation by this grade is lower than 12, no treatment is needed. Live happily ever after. Very probably they are just some freckles. It can be some spot of lentigo, which can be addressed with a laser, which is golden standard of the treatment for this type of the pigmentation, but there's no need to treat it with some intense program. If your MASI score is in between of 12 and 24, you will benefit a lot from the skincare, specific brightening skincare. If you're looking for brightening in Medar, it would be Luminoderm range, and energy cleanser and energy antioxidant serum rich in niacinamide to help Luminoderm range to give you best results. If your score is in between of 24 and 36, you continue to use appropriate skincare, but you should understand then in 2-3 months of the topical skincare treatment, the rest of the pigmentation should be eliminated with the laser treatment, which once again gold standard of the pigmentation treatments, or probably some other treatments like chemical peels. I prefer laser. If it is in between of 36 to 48, apparently the pigmentation is very prominent. So I will suggest that you use the brightening skincare for at least 3 or 4 months, and you will definitely need energy-assisted treatment and very probably a few sessions of energy-assisted treatment. And every 2 or 3 months, we reevaluate the pigmentation to see what is the trajectory of our treatment and our therapy. So the skin diagnostic algorithm at maximum is the diagnostic of 7 steps. Dry or oily, how dry and how oily is your skin, if needed, acne score, sensitivity score for everyone, absolutely essential. If the skin is red, we are using the specific redness score. If you're worried about the wrinkles, we evaluate the type of the wrinkles and severity of wrinkles with Merz scale. And if you notice some disturbance of the pigmentation on your face, we diagnose the type of the pigmentation and severity of the pigmentation. And according to all this diagnostic, we can choose the proper professional treatment. We recommend, suggest, and prescribe the individualized, personalized home skincare routine, and we can use it once again for all follow-up. We do this reassessment to evaluate how efficient is our approach. As you can see, it takes time. The first consultation takes at least 30 minutes, maybe until 40 minutes, but it's absolutely worth it. And now you're well equipped, and you understand that even if you don't have any specific instruments, any expensive tools, if you have your brain, your knowledge, and your observational tools, you are good. You can diagnose your skin and the skin of your patients. If you have any question, please leave them in the comment. You can visit our YouTube channel to watch the specific workshop about the skin diagnostic and the professional choice of Medar biofacials. And please subscribe to our podcast. Follow us on the socials, Medar Beauty, when we share every episode. And share this episode with all your friends who are looking for the proper skin diagnostic.